Click up there. There we go. I was going to say that's about as far away as we'll be able to get rid of it. So anyway, I'm going to show up in the video. I'm Cindy. Sorry, we're doing a whole lot of moving and grooving and trying some new things today, so I apologize. We have a lot of moving pieces today. So I'm Cindy Fowler. I am the regional coordinator for the Alzheimer's Association here on Kauai, and like I said, on Maui County. And this program has kind of become my baby, and we've been able to partner with AARP and the Hawaii Public Library System, specifically here in Lihue, to have these sessions once a month where we do a dementia-related topic. And we try and jump all over the place and kind of think outside the box and come up with areas and topics that are important to caregivers and also people that are just concerned about dementia and want to learn more. So if you have an idea in mind or a topic that you'd like us to see if we can find a speaker on, let me know. I would gladly try and find more resources here. Tonight we're going to be talking about self-care, and my very amazing friend Robin, who has tons of experience, and we were at a program last week, and we were there with Dr. Pizzotto, and he had a little bit of a medical issue. I know some of you guys were here last year when he had a medical issue. It was very similar, and so he is kind of stepping away from public speaking for a little bit while he focuses on his health. And Robin jumped in and said that she would, say jump in, she is very willingly picking up the torch or the baton, and she's going to tackle this topic today, and I think it's a really important one for us. Before we get started, I do want to just run through my little housekeeping slides. Thank you to AARP and the Hawaii Public Library System. Our lecture for next month is going to be Dr. Ash is going to be coming back, and there we go, thank you. And if anybody has seen Dr. Ash before in one of our lectures or had the privilege of having him come out to your house for one of his home visits, you will know he's a very knowledgeable, really great guy who speaks in very layman term about dementia. And so since I always get the question, what's the difference between Alzheimer's and dementia? What is Lewy body dementia? We thought it might be good just to have him come and talk about the nuts and bolts. And he's going to be talking about the 4 most common types of dementia and giving us a little bit of an introduction about what they are and maybe the subtle differences and maybe how you approach and treat them differently. So that's next month. There are flyers over there if you're interested and want to grab one. And then for May, we have Christine Uramura, who's a clinical psychologist over at Wilcox. She's going to come and talk to us about cognitive stimulation and that's going to be for caregivers to just give us some ideas of things that we can be doing on a day-to-day basis that make the day maybe fill up a little bit more or have a little bit more stimulation. And then we have lectures later on in the year. Robin's going to come back. I think that's in October or November. Somewhere late in the year. Dr. Lau is a lot of people's primary care physician, and he's got a geriatric specialty. He's going to come and talk about driving and dementia.
No, it's not LAO?
LAO. Oh, I spelled it wrong. Yes, that is misspelled. It's LAO. Yes, I misspelled. And then Dr. Kaleka is going to come back and talk about depression and dementia. So we've got a few really good ones set up for later on this year. Just a reminder that we've got the Empowered Caregiver Series. I try and run one of those every month. It's a 3-week program. We meet once a week for about 2 hours. I'm doing one out at the Waimea Library right now, and we're in week 2. And I'll be at some library in April or May, and we'll do it again. We're also doing this statewide virtually, so if virtually is a better option for you, come and talk to me, and I can give you the link to register for that. We limit the class to about 10 people because it kind of gets deep, and we feel like virtually especially, it needs to be fewer people so people feel comfortable talking and sharing. And so when we started this in January or February this year, we had like 60 people register straight out of the bat. And since we're limiting it to 10, we're just kind of keeping a running list and calling people as spots become available. But it's a great series. If you're providing care for someone with dementia, it gives you a lot of new tools kind of for your tool belt to deal with the day-to-day, and then also just the changes as they happen. There's mention to that the virtual version. And then we have a program that we do through the neighborhood centers on island, and the program that we're doing this year is called Healthy Living for Your Body and Brain, and it is basically brain health 101 and risk reduction 102, and kind of talking about if you're healthy, here are some things that you can be doing to stay healthy, keep your brain healthy, reduce your risk. And each month we go to a different location. If you see tomorrow, I am at the Kauai Neighborhood Center at 10, and then next month I'll be in Kaloa. If you're interested in attending that, there's this sheet that's just right over there, and you can take a picture and snap it and figure out which neighborhood center and date is closest to you. And then we have support groups. We have 5 support groups here on the island. They vary on location and time of day of the week. Try and make it and spread it out as much as we can so that people have options. We did just start a virtual support group that is meeting, and it met today, so it meets the 3rd Wednesday of every month. This form, this sheet right here, I have copies of it there too, and you can feel free to take it if you're looking for a support group. It will give you dates, times, locations. This is completely last minute, but if you're not doing anything tomorrow, our annual caregiver conference is over on Oahu, and then we're actually rerunning it the next day on Big Island, and it's on in Hilo. So if anybody's interested, there's little flyers for that. If you want to take a flight over, it's free, and you can just show up for tomorrow. Our state chapter does a virtual education program each month. I do not think we're doing one in March because of the caregiver conference tomorrow and Friday, but our April one is going to be about palliative care, and I know that's a subject people want to learn a little bit more about, especially when it relates to dementia, because it's so hard to get some of these end of life or that moving into that kind of stage. It's a lot harder to get services when the diagnosis is just dementia, and there's no comorbidities that go along with it. So that's going to be on April 9th, and I can get information to you for that if you are interested. And then last, the Alzheimer's Association is one of the 60, I think, plus nonprofits that was selected to benefit from this year's charity walk. And so I am looking for people that want to put on some purple and come out and walk with us. It's on May 3rd, I think. It's Saturday. It's over at the stadium. And it's a fun day. They have lots of different things. Because it's run by the hotel and tourism industry. All the big hotels come with their fancy restaurants, and they give free samples, and it's a fun day. You can eat your T-shirts. What's that?
They give us T-shirts.
They give you so you have to sign up. Yeah, you have to sign up with Charity Walk, and then they give you a T-shirt. So
that's not purple.
It isn't purple, but
It was last year.
the cool thing that they are doing is that everybody who is on the Alzheimer's team, we are able to duplicate that now for the Walk to End Alzheimer's, and so anything you donate to Charity Walk will actually count in your fundraising efforts for the Alzheimer's Association for our walk in October. So kind of get to double dip it. With that, I am done. Thank goodness. Let's see. I now want to get Ms. Robin introduced, and we're going to get your slide deck, which was down here. There you are. And then now I need to go over to Zoom. And
No, you shared your desktop, so you're okay.
oh, I shared from the desktop, so I'm okay.
Yep.
Good, thank you. That's where I usually mess up on this slide deck. Are we got it? Okay, good. So I'm gonna get.
I think you shared your desktop.
I know, is there a way to tell?
Only look at the, yeah, the little sharing thing is gone from the top.
Oh, yeah.
So you must have shared the prezo.
Okay.
Do Alt-Tab and it'll switch between apps.
Do what?
Alt-Tab.
Tap. Oh, you're gonna put the glasses on. Tap,
That should switch to other applications.
If I go here and hit share, that's usually what I do. There we go. That's working now. It's showing me it's sharing that one. So we're good. And then I'm gonna go in the beginning here and hopefully that makes that big again.
Oh, it's big.
It is big over on yours?
Yeah.
Okay, good.
She's got the presenter's view.
All right. So, Robin, if you notice, there's kind of this little, that screen is up there where it's showing what.
I see that.
So, you don't have to stay in this, you don't have to stay in this, but you can if you want to be seen. So, so I'm going to read, and I apologize for this.
Oh, there should have been in full sentences.
Oh no, I can convert this into full sentences. So, Robin Bond, master's degree in nursing. She's a nurse practitioner, certified as a gerontological, there's no AL in there, gerontologic nurse practitioner. She designed, she developed, and she implemented a memory center where we evaluated, diagnosed, and managed people with dementia. Her program was very successful that she developed, and the template has been used to start at least 4 other centers in the Western U.S. She also cared for both of her parents who had dementia. So, give a warm welcome to Ms. Robin. Thank
Oh, just so I have an idea of who I'm talking to, can we just really quickly go around, and we're going to start in the back, and just say your name, and if you're a caregiver for a family member, or if you're a paid caregiver, or just give me an idea who you are, okay? Just so I know who I'm talking to. Okay, go ahead.
I'm Deb Thompson, and I moved my mom into my home 4.5 years ago. Dr. Ash actually just diagnosed her with vascular dementia. That was good to know. I finally have a diagnosis.
Isn't that nice? Isn't it nice to get a diagnosis? It helps. Yeah.
Anita Aquino. I'm caregiving my husband, who almost 3 years ago got diagnosed with having Lewy body dementia. He's at LVP.
And she made our beautiful ladies there and there. Thank you. Big mahalo.
Hi, I'm Edna Kaya. I'm not caregiving now, but long time ago, my parents both needed care, so this is just a good keeping abreast of what's going on.
Okay.
Thank you.
So,
Hi, I'm Zoe Schindler. My girlfriend has early Alzheimer's and she's been in Garden Island for about 8 years now. And my mom just moved into Kauai assisted living.
Oh, I didn't know that.
Yeah, she's 96.
Ray?
I'm Ray Permuta. I'm a family member. My sister-in-law had early onset Alzheimer's, and she passed away 3 years ago.
Rose, I'm a friend trying to learn how to take care of myself with all these new things that are happening, and I'm not sure what's happening, but I need to find out more, for my friend and for myself.
Great. Good friend.
we all need friends.
Yeah,
We all need friends.
I'm Beatrice Newman, and for the past 7 years I've been taking care of my husband, who suffered a stroke. He's 90 now, and although he has a form of aphasia, it's expressive aphasia, he does not show any signs of actual Alzheimer's. It's just that.
It is.
But
that's
you never know.
Yeah, that's particularly a frustrating one. Yeah. Go ahead.
Hi, I'm Sharon Enos, and I'm a caregiver for my husband for 5 years. So Amy Asante, I'm a caregiver for my husband as well.
Okay.
Stephen Asante.
For some. Welcome, everybody. Thank you. As Cindy said, these are my parents. This picture was taken, I was trying to figure on the way here how long ago it was taken, probably over 30 years ago. They both had dementia. My mom, Pat, had a combination of vascular dementia and Alzheimer's. And my dad then developed vascular dementia after she passed away. It was his turn. And I just have a few pictures just because I like them, and it's not moving, right? Oh, it is moving. It's not moving on my screen. Oh, that's interesting. Okay, I'll just get, this is, I can look up there. This is a picture my daughter painted of my parents shortly before my mom passed away. This is a picture of my mom later. This is what the dementia became. That's me and my brother and my sister, my dad, and my 2 daughters. And then, after she passed away, this is my dad. My dad would spend as much time in the ocean as he could. He loved the ocean, even when he, he's down there with his walker going to the ocean. And on his 90th birthday, he had dementia. He swore in probably the last year of his life, I can still swim. I can swim better than I could when I was 12 years old. And so on his 90th birthday, we took him down to Anini Beach, and that's my daughter and my granddaughter and our wonderful caregiver that we had hired at that point. Her name's Cheyenne. She was going to nursing school, and she's a nurse now up at the Wilcox Long-Term Care Facility. I cannot say enough good things about Cheyenne. So we took him to Anini Beach so he could swim and show us all he could swim. He did the weirdest thing. He was turning, and he was not going forward. And I'm so glad we had our caregiver there and my daughter, because there was no way he was swimming. But he was sure he could swim. But that was on his 90th birthday. He died shortly after that. This is my favorite picture. Okay, and this is my other favorite picture of my dad. That's me when he had short hair. And that's my granddaughter. And they had this connection. It was wonderful. He was demented there, but she didn't care.
Right.
Right. Yeah. Anyway, here's what we're talking about. Practicing self-care. And I'm giving a special shout out to Dr. Pizzato because Cindy was kind enough to share his slides with me. So even though in my former position I led caregiving groups, I did caregiving lectures, it was a while, and so I thought, well, we're going to take his slides and use them as a basis. So I shout out to him, and I hope, Dr. P, that you're feeling self-care. Exactly what is it, all right? When I was taking care of my parents, people saying, oh, Robin, you have to make sure you're taking care of yourself. It's like, what do you mean? What? What am I supposed to do? What does that mean? You hear it all the time. You're supposed to take care of yourself. Darn it. But I couldn't figure out really what it was, even though I'm giving, at that time, giving lectures on self-care to other people. I didn't know what it meant to me, okay? Because self-care is different for everyone. What's going to be self-care for you, probably not going to be self-care for me, okay? So I need a volunteer. Anybody? So come on, somebody be my come on, Beatrice. Beatrice, right?
Yes.
Come on up.
Thank you, Beatrice.
All right.
Got props.
I have a glass for you.
Oh, thank you.
Okay. hold your arms straight. Okay, your job is to stand there. Okay, put your arms straight out. There you go. That's perfect. Okay, here are the rules.
I think I did this with a beer once.
I wish I was embarrassed. Your job is to stand there. Okay, here are the rules. Okay, you can't set the glass down. Okay, you can't hold this arm with your other arm. You can't rest your arm on anything, and you can't drink the water. Okay? That's all you need to do. We're going to keep going. You're going to have to look up here for the slides, okay? The obvious thing, what is self-care? Well, Dr. P said, obviously, self-care is wellness. Wellness is the obvious object of one's self-care, but you have to keep in mind that wellness is not just not having a disease. It's not just not being sick. It's about a balance between your mind, your body, and your spirit. Okay? He said the most important components are as follows. All right? Number one, diet. Okay? A reasonable diet. You don't have to go on some super diet where you're eating, I don't know, super greens and keto something or others, or just a reasonable, nutritious diet with moderate proportions, not a huge proportion of anything, nothing that you're used to eating. It's just moderate portion control. Remember to drink. Remember to drink water. Water is very important for you, all right? It's more than just snacking. And if you've been a caregiver for a while, you might find that you're not eating meals anymore. You're just snacking all the time. And even if they're helpful snacks, that's not a good way to get nutrition. You have to remember to eat. Eating, it turns out, is social. All right? Oftentimes people who have dementia, they quit eating because nobody's sitting down and eating with them. Well, this is something you can do. It will take care of them, but it also takes care of you. So sit down, have a meal every day. You know, it doesn't have to be dinner. It could be you have a nutritious lunch every day. But get a nutritious meal every day. Exercise, okay. Age appropriate, right? So none of you have to run a marathon, okay? That's strength or flexibility or cardiovascular sort of exercises. The parts in green are my parts, okay? Do something you like to do, all right? If you hate doing calisthenics, don't choose calisthenics as your exercise. It should be something you enjoy doing, okay? A trick is to do it with a buddy. You know, set up a time to do this, that you're going to do this every day. You only have to do 150 minutes a week. Sounds like a lot, doesn't it? That's half an hour a day, only 5 days a week. It's not 7 days a week. Half an hour, 5 days a week. So, you know, there's something you might want to do. It doesn't, Sandra O said, self-care doesn't necessarily mean jogging. It doesn't have to be jogging, although I do look like this when I jog. So, no, I don't. I don't look like that at all. But find some exercise you want. You can be going for a walk. You can be biking. You can be, I do yoga every morning. And my buddy is my 8-year-old granddaughter. And if I don't do my exercises, she is, Tutu, have you done your exercises? Rest, so very important. Good sleep habits and relaxation time during the day. Not just at night, not just little naps during the day. So, things you can do. Arm out straight, please.
Can't.
You can't?
Not anymore.
You can't?
Yes.
Ah.
I have arthritis.
Ah, oh, yeah, okay. But the rule is to hold it out there. The rule is to hold it out there. No?
I better drink it then.
Okay, well, we will let you, we're gonna.
I gotta put it
I
down.
don't want to, you gotta put it down.
Yeah.
Okay. If you can't put it down, and you can't drink it, okay?
I can
What
pour
can
it
you
over
do?
my head.
You can't pour it over your head.
Oh, you didn't say that at
You
first.
can't empty the glass.
Oh, that's
You can't drink it, you can't empty the glass. What could you do?
find somebody else to hold it.
There you go. Very good. You just- That is, you can go sit down. You can drink the water if you like. It's fresh.
I didn't bring it.
Would you like it? Here, you will the water.
Thank you for being
We're going to get back to that in just a second. Many mental breaks are important. During the day, you probably can't, if you're a caregiver of someone with dementia, taking a break is hard. But you can take a 5-minute break. You can get them involved in something to take 5 minutes and just sit quietly and breathe. You should get a regular sleep routine. This is both for yourself and your loved one. This means every night, the same routine. We wash our face, we brush our teeth, we put on our jammies, we read. Reading to somebody with dementia is a lovely thing to do. We read, we go to bed every night. Same thing. For my parents, it started with dinner and then watching Jeopardy and I think Wheel of Fortune, and then routine that they did and reading and doing that as a habit. It trains your brain to go to sleep. It trains the person you are caring for as well as your own brain, which is important. It's odd to have caffeine or high sugar after about noon. In my old age, I can't have coffee after 11 in the morning or at 2 in the morning. I'm saying, what made me think that was a good idea? That because it will wake you up, even if you manage to get to sleep, it will wake you up later, and nobody wants to get up at 2 in the morning. No screen time for about 2 hours before you go to bed. Screen time means no TV, no phone, no computer, because there is something about the light coming from the computer to your eyes that stimulates your brain. It's like it charges it. It supercharges it. If you do that 2 hours before you've gone to bed, you will not sleep as well. Try it for yourself. Try it for your loved one, but no screen time 2 hours before bed. And when you sleep at night, it needs to be sleep. It can't be what I call on-call sleeping, because I've had several jobs where I was on call. And let me tell you, when you're on call and you're sleeping, you're never really sleeping because you're waiting for the call. You're waiting for that. And when you're taking care of someone with dementia, you're waiting to hear them get up. You're waiting, what are they into now? Was that them falling? So it needs to be, you need to find a way to make them safe so that you can have sleep. Okay, stress management. I read what Dr. P wrote, acknowledgement. And why is he saying that? And then I realized, sometimes we don't acknowledge that we're actually stressed. No, I'm just doing what I should be doing. This is my duty. This is my job, that I have to take care of my husband or my daughter or my partner, whoever. These are over there. These are from the Alzheimer's Association. And inside they have 10 common signs of caregiver stress. My daughters are telling Mom, you're stressed. No, I am not stressed. Why do you keep saying I'm stressed? 8, irritability triggers negative responses. Yes, there are a number of things. Please take these and read these. This is very helpful. When you start seeing these things, it's like, oh, maybe I am stressed, okay? So what do you do about it? Some people go to church or a synagogue or a temple, and some people just talk to God. This is actually a stress reliever. It's like giving your problems to somebody else for a while. Meditation is a very good stress reliever. Massage. My daughter used to buy me massages, and I go and I say, oh, okay, that felt good and stuff. And then I get home and it's just as stressed because for me that wasn't it. So all of these are not going to work for you. Find what works for you. It's going to be different. Yoga. I do yoga though. Yoga is very good for me. I do it almost every morning. Breathing exercises are great. And breathing exercises are something you can do during the day. I mean, you can feel yourself, I feel myself, my stomach gets a little tight and I start tensing up. That's my trigger. That's something I recognize now, where I need to go. All right, it's going to be okay. It's going to be okay. Whatever it is, get through this. Anne Lamont, who's a wonderful mother, said almost everything will work again if you unplug, including you. So I do. I go. And that's my unplug. All right? You need to find your own unplug. A few more tips. Self-praise. This is important. You know, you're caregivers. This is a hard job. It is a very hard job. So pat yourself on the back. Say, hey, I'm doing a hard job. And I haven't died yet, so I guess I'm doing okay. I mean, nothing catastrophic happened, right? So you're doing okay. All right? You are doing a remarkable thing. And you're doing a good job, and you need to tell yourself that. And be grateful. Things probably aren't exactly like you wanted them, or you imagined them. Nobody imagines they're going to be a dementia caregiver. But if we take a moment to be grateful for the things that we do have, the things that are going on, you have your own health, you have your own, then it will make you feel a little bit happier, a little bit better, a little bit more relaxed. Okay, this is where I was going to ask you how you're doing. I'm sure it'll last longer than that.
Maybe 10 years ago.
Maybe 10 years ago. The glass is the person you're caring for, right? It's easy to hold it for a minute, a couple minutes. How long do you last? I don't know. But it gets harder and harder and heavier. And even without me pouring more things in, like now you've developed some other thing with your dementia, and yet we do it. So what should you do? You should do exactly what Beatrice did. Ask for help. Asking for help is not a sign of weakness. It's a hard thing to do. It takes a lot of strength to ask for help. Okay? Society kind of teaches us that if we ask for help, we're weak. But it isn't. It's actually a sign of strength. The strongest thing you can do is to ask for help. Recognize that you need help and ask for help. Funny thing, most people are complimented when you ask them to help. This is because of a few things. First of all, you let them into your world. You've let them see that you are not the all perfect being that's the caregiver. Just, no, I'm human, just like you. I'm tired. I need a break. Okay, and it also means you trust them. If you ask someone to help you, you trust that they will do that. 90% of the time, when you ask somebody to help you, they will say yes, and they will feel good about it, all right? And if they don't, fine, ask somebody else. This can be family. This can be friends. We have a good friend here. It can be whoever. It can be people in your church. Ask, if you have a minister, ask your minister, say, I need some help. Who can I ask? Just ask. Introducing a helper or a caregiver to your loved one. If you say, honey, this is your caregiver, they will say, I bet you know what they'll say. I don't need a caregiver. I don't need a caregiver. My dad said it for me. She doesn't need a caregiver. I'm here taking care of her. Right, Dad. Right. I know. They were at that point, and I was not living with them, and I was working full time. And every day they were going to Burger King for dinner. And I thought, that's not exactly how this should be going. I think maybe we need to be getting somebody in here that's going to help cook. So what do? How do you introduce them as not a caregiver? If it's a friend, it's easier because you say, oh, somebody's coming to visit, but you know what? I forgot I have an appointment I have to go with. Honey, how about you guys just play cards or watch a movie or why don't you show her our photo album or whatever, and just get them started on doing something. I'll be right back. I just got this appointment I have to go to. Right? So that it's not that they're coming there to take care of them. The person you've invited over to help has to be in on this, of course, so that they know why you're talking so strangely. If it's a hired caregiver, somebody that they've never seen before, it is often very worthwhile to have them come over once or twice when you don't leave. You are there also. So you can show the caregiver how you do things and what works and what doesn't, because it is not the same for any two people. Right? And they also get used to having this person over, but you're having them come over as your friend. Hey, this is my new friend I met just the other day. And so if they come and your loved one gets used to them being in the home, they're much more likely to go with that, honey, Cheyenne's coming over. Cheyenne just came over and I forgot she was coming over, but how about you guys just do this today and I'll be back. It's much more easier. Much more easier? It's much easier. And then you don't have to confront them and telling them they have a caregiver. Won't that? Right. Those here. Okay, this says, it's somewhere about there, it used to say, the paperwork. This is my feeling about paperwork. I probably hate paperwork more than anyone I know. But there's a thing called advanced healthcare directives. Theirs and yours. Does everyone know what that is? Yes, 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 yes. Yes, okay. Theirs and yours. Let's start with yours first. Do you all have advanced healthcare directives? Because let me tell you what will happen if you have a stroke and somebody calls the ambulance and they take you and your loved one, your husband, to the hospital. In the emergency room, things happen quick, and they will be looking to your loved one to answer questions about your health care. They don't know your loved one has dementia unless there's somebody there to tell them, or it's documented in your record. So they're going to ask your loved one to make often life and death decisions for you. And this is bad for a number of reasons. First of all, it's they can't make good decisions. They can't make a rational, good, appropriate decision based on your wishes. Number two, it is very stressful for them. It's a terrible position to put them in. It's going to upset them, and they're going to, for a long time, be upset about it. So, so have a talk. Write out your own health care directives, and then have a talk with whomever you appoint, your son, perhaps. Make sure he knows, or she, whoever you appoint, knows your wishes. Don't assume they just know. I have, my daughters are grown now. They're in their 30s. And I have been telling them since they were, I don't know, 8 or 9, what my wishes are. I am very clear about my wishes with them. I would, just quiz them. Because you don't want to have one big talk. Nobody wants the one big, heavy talk. It's like the birds and the bees talk, You really didn't want to do it with your kids, and heaven knows if you were a kid, you really didn't want to have that talk with you. No, please, just but if you break it down, and if you joke about it, and get them comfortable with what your preferences are. It doesn't matter what your preferences are, but make sure whoever you have appointed knows what they are. You can have anything. On my advanced health care directives, I told Cindy, one of the things I have is keep me warm. I am, if everybody else is pleasantly warm, I'll be freezing. My hands are like ice right now. Okay, you're probably all doing fine, right? I am cold. So in my advanced health care directives, I have, among other things, keep me warm. You can put anything there, okay? This goes for your directives as well as your loved ones' directives. Have more talks. Have talks with your loved one. Do you know what your loved one's wishes are? Don't assume that you do. You might be very surprised at what they would want done for them. Should their heart stop, or should they need intubation, or should they need CPR? You might be surprised what they say. And then, if you haven't had the talks and you're in the position of, if you're in the position of having to make those choices, you will find if you let them go or not let them go, or something happens, you may be second guessing yourself for the rest of your life. Did I really do what they wanted? But if you hear from their mouth to your ears, and if somebody has dementia, sometimes it's threatening to them. They think, oh my gosh, why are you asking me this? Am I going to die? So, no, honey, I was just thinking about this for, I'm filling this out for me, but I was just thinking, I don't know what you want. What do you want? If this happened, what would you want? So that you know. If your loved one is still at a point they can explain things to you, ask them some important questions, like, what is important to you to live? What would you not want to live if you didn't have it? If you couldn't If you couldn't speak, would you still want to be alive? If you couldn't recognize me or any of the family members, would you still want to be alive? And it's different for everyone. You know, we all have what's important to us, what we think is valuable in our own lives. A very good friend who said, I wouldn't want to be alive if I couldn't laugh at people's jokes. But that encompasses actually a lot of things. It means that he wouldn't have the cognitive ability to understand those jokes. And if he couldn't do that, he didn't want to, it just wouldn't be around. This doesn't mean you're going to then them if they can't do this. But it does mean that perhaps if they develop pneumonia, you don't have to treat the pneumonia, which seems foreign to some people, but you don't have to. I think of having a dementia as something you've been given in your life by God or whatever, and people say, well, you know, I have to treat the pneumonia. I'm not going to play God and not treat the pneumonia. But the funny thing is, that's backwards. You're playing God by treating them. God is there saying, no, here is your ticket out of this. And you are snatching away that ticket and saying, no, you've got to stay here with me for a while longer. We can keep people very comfortable when they have pneumonia. It's a very peaceful way to slip away. So you don't have to treat everything that they have. When it gets towards the end, when it's time to let go, you don't have to treat everything anymore. So if someone has told you ahead of time, when I don't want to be around if I don't recognize you or if I can't laugh at jokes, and if that happens, then you know it's okay if you let nature take its course and not treat things and let them go. What is important to you? I asked my daughter, what is important for me to say in this talk? And she said, boundaries, Mom. Boundaries. What do you mean by boundaries? And she said, well, people should write down, as a caregiver, write down what you are willing to do as a caregiver and what you're not willing to do. Am I willing to clean up my loved one if they're incontinent? I have told my daughters, you are not to wipe my butt. You are to hire someone to do that, all right? And that's important to me. But they're on board with that. But I did that for both my parents. Of course, I have a nursing background. It sort of comes more naturally to me, but they don't, right? So as a caregiver, write down earlier on what's your boundaries, what's my limit? Because when we are caregivers, we tend to just keep going as a caregiver, and there's just the next thing, and we just take on more and more. We never thought we would be doing this, but oh my gosh, here I am doing this. And if you set that boundary early on, and you can look at your list and say, hey, I don't want to be doing this, and now's the time for me to be figuring out how to get help. And if you're not sure how to do that, call the Alzheimer's Association. They have a wealth of resources to help you figure out how to get some help. The till death do us part, I heard this so often. But I promised them I would take care of them till death do us part. So, if your loved one had appendicitis, would you take out their appendix? I am certainly hoping no. All right? Why not? Because it takes a skilled surgeon to do that, someone to do that. Have you been trained in being a caregiver? Are you a trained caregiver? No. And taking care of somebody, especially with later stage dementia, takes trained people who have experience doing this. So hiring, bringing in, we're taking them somewhere where there are skilled people to take care of them, I would argue is the best way to care for them till death do you part. It's not caring for them. It is getting them the best care that you can possibly give them. Who can I call for help? Number one, the Alzheimer's Association, or your friends, or your family, anybody. You know, make a list of people who you can call for help, and have it. Put that next to your list of your boundaries. And who am I going to call for help? And you can start talking to them, you know, your friends, your family, before you need help. You know, hey, if I needed some help, you know, down the road, would you be willing to? And start to get them ready. Well, that's fun. Gets you ready. It sets the stage for you to ask. All right? Because you need to. You're doing a great job. I know that. Because you're here. Because you're here to learn more. You're here to take care of yourself. So I know you're all, each and every one of you are doing a great job. Questions? I didn't tell you to say that.
No, you're fine. I wanted to just say something. I have a daughter that has profound special needs. She's 27 now, but she functions like a 1-year-old and has, you know, is still in diapers, has never spoken, very, very low functioning. I was always on call, sleeping. She had pretty bad seizures, and so lots of seizures at night, and so you always kind of slept with one eye open, one ear open, so that you could make a run for her room. But because she was my first child, that I didn't know anything else. That was just being her mother and growing up. And then as she got older, and it was very apparent that she was never going to be able to, you know, capably do anything independently or even remotely independently. We had an opportunity come up where she had a bed come up in a small group home in our little town we lived in Colorado. And we tried it for a month. And it was the hardest decision I ever made to let my child go live somewhere else because she is so low functioning. I just didn't think anyone could do it. But what happened in that month when we were just doing the trial to see if it worked for them and for us, I became a good wife again. I became a really good mom to our other kids who I had not been able to invest much time in because I was always doing care for Haley. But I also became a really good mom for Haley because the things that had driven me crazy, and because I didn't set those boundaries, I just, you know, if we had diarrhea in a diaper, I dealt with diarrhea in a diaper. You know, like that was just life. But when I could go and pick her up at her home, and we could go to the mall and go up and down the escalator 80 times, and that was our day. You know, when I was a fried caregiver, it was drag her on the escalator, drag her off, and now we gotta go. But she loved the escalator. So now I could just take her to the mall, and we could go from one end to the mall and hit every escalator. And it was silly, but it was meaningful to her. And then I could go and get her favorite cheeseburger, and then we could go to the pool, and then I could take her back to her home, and we had an excellent day, and our relationship grew because I wasn't that primary caregiver, and I had realized that the level of care she needed exceeded what I was capable of doing and still being able to maintain the other relationships in life and a career and a home and all of those things. And she has a better quality of life now than she probably did when I was taking care of her all the time. And
Quality
she's
over
got
quantity.
Quality over quantity. When she sees me now, I come at her with a smile, where half the time it was just a fried. My husband called me, when you are around Julie, I call you hair on fire Cindy. And I was just like, oh gosh, that's not what I want the world to think of me as, just this stressed out person. And so I think that I didn't realize, because I just was, in the motherhood gig, and I didn't realize how much self-care was. And when I would go to talks about this, always it would come up meditation and breathing. I'm a super active person, and I was like, I cannot sit still somewhere and meditate. That's like my worst nightmare. But for me, it was finding those things, and it's different, like she said, for everybody. But when you find those things, it fills up your cup to where you can go back and have that energy.
Yeah. So how many years did you? I mean, you had a lot to deal with your first child, and how many years did it take you to finally say, hey, I need, I'm gonna hand this over to someone else. I'm gonna give this water to somebody else.
She was 19 when we
Wow.
finally looked into that. So
Oh,
it was a long time. Yeah.
I have a friend who took care of her mom. She and her sisters alternated days. Their mom was still living with their dad, and he would take care of her, and then they each had, 3 or 4 days a week. They'd go and help him, and they all went on a trip, and they have respite at Wilcox, and they put her in respite, and she said, Robin, she looked better than she has at home. She was finally relaxed, that because she had people taking care of her who knew what they were doing, who weren't, anxious and weren't stressed out and weren't trying to do their whole lives while they're also taking care of their mom. And her dad wasn't sure that was true, because he didn't want to think that he was somehow failing. But it wasn't that he was failing at all. He was asking himself to do something that was not what he was good at, and he was doing his best. They all were. But when she was in care, she was so much better. I've heard that. I can't tell you how many times from people that I don't know why I waited so long. Care can be expensive. It's something you may think of for yourselves, getting long-term care insurance so that there's some finances to pay for care for yourself. Is a long time ago I got long-term care insurance so that, when there are things. If I'm not nice, don't keep me at home. And some people, I'm mostly pretty nice now, but some people, when they get older, they get not nice. My parents both got nice. And I said, if I am not nice, I don't want to be around you. I don't want my grandkids to remember me that way. I want them to remember me as a nice person. So, yes, put me. And if I'm not nice, if you come and visit me wherever you put me, then don't come visit me. Really, I don't want you. And they say, no, Mom, we're never going to pick you anyway. But I've made it clear to them, that's my wishes. And, we'll see what happens. I won't know what happens. Well,
I think we have this in society where I'll never put my mom in a home.
right.
And that is really hard.
I would tell my couples, don't make your family promise to never put you in a home. Sometimes that is the best place for you and them. that is,
Right, and that was, I was so lucky because I had doctors who said, Zoe, we're gonna help you do this, and they just helped, my loved one into long-term care. So it really almost wasn't a decision I made, they kind of knew that this was right to do.
You had
they-
good support, huh?
They had seen
That's-
other people.
and that is a good support system.
Yeah, so I
Yeah.
was kind of lucky because they had,
Absolutely.
Yeah.
Seen it.
But
Yeah.
I hear people say, I'll never do that, and I'm like you said, it might not be the best thing sometimes. I think they get better
Right.
care and everything, yeah.
Right, and don't put, there are good care homes and bad care homes, of course. Don't, put them in, somewhere you wouldn't put your dog. It's like,
Do your homework.
do your homework. Good, but there are.
Yeah.
Ray, were you gonna say something?
Yeah,
I saw half a
I
hand go.
think one of the things you've got to be careful about is delaying the decision too long.
Yes.
We delayed too long with moving my parents out of independent living into assisted living, and by the time we were moving them into assisted living, my father's mental decline was such that they put him on the 7th floor in memory care and put my mother in an apartment on the 6th floor.
Oh,
If they moved, if we forced them to move earlier, my father would have been okay
oh.
in the assisted
Right,
living.
and he would have gotten to know the place and it would have
And
been
live
familiar.
together.
And they could have lived
They could
together.
have lived together.
Well, they still lived
Well,
together, just one floor,
yeah,
one right above the
Yeah,
other.
see,
But
yeah.
by waiting as long as we waited,
Yeah.
my father was cute, and the person who evaluated him didn't like his brand of cute, so he wound up in the memory care, and he declined relatively rapidly, not having my mother there all the time. And for their marriage, they probably were better on the 6th and 7th floor. But they could, my father, I think, would have been fine if they had moved earlier and they'd been allowed to move in together into assisted living.
In my position in the memory center, I often counsel people to move to an assisted living center because they're in very early stages of dementia. Move now, move now. And people would put it off, and put it off, put it off, and then they would move, and they'd come in and they'd say, I can't tell you how many times I heard, I wish I had done this sooner. Because moving to an assisted living, you don't have to go to dinner every day. You don't have to, there's so many things you suddenly don't have to do. And
They frequently have discounts for couples.
Right.
It brings in other sets of eyes so that you've got some extra people
How
on
many
your
years
team.
did you?
They
You've
have
got
things
social
to do.
interaction. Yeah, the social.
My
Lots
brother
of
did
things
most
to
of the
do.
care.
There are
But still,
other
yeah.
people
How
around
many years
who have similar
before they went
interests.
into-
And it's just,
Well, they were okay in independent.
have, really, so many times I heard,
20 years.
Oh, yeah.
I'm constantly telling people, try to be proactive instead of reactive.
Right.
because if you can, like you were saying, doing those talks beforehand,
Oh.
planning things in place, it
Yeah.
all helps for your mental health.
yes.
Constantly reacting.
Yeah.
I use my mom as an example
I
because she had
can taste,
Parkinson's. Everybody knows that with
some
Parkinson's,
kind
a lot
of
of
very
times they start
sensitivity.
having
I
falls.
can
And
taste.
so I just felt like we were constantly reacting to one fall from, what are we doing?
Mm-hmm.
Oh, we broke a hip this time. Okay, well, now we cracked our hip. And so it was just always reacting to what was going on instead of saying, when we get to this stage, we're gonna go here. We're gonna do this.
And I think you want to go before you get burnt out.
Exactly, before the caregiver.
Yeah.
Yes, because then they have support. Yeah.
For me, my hesitation is the financial part.
The financial
I
part is a
never
big-
we never invested in long-term care,
Yeah,
not even thinking we need it. So
yeah, nobody,
that's
nobody
my-
thinks they're going to have dementia.
And
Nobody
it's
thinks
tremendously
they're-
expensive, and
Yeah,
it's
it's
tremendously
tremendously
expensive,
expensive.
even more so on this island. And, we frequently
Absolutely.
have people that have to go over to Oahu, or they move to the mainland where there's more options.
There's now, Jake has his company that's trying to provide affordable home care in the home I don't have his,
It's still expensive. It's still very,
it's
very
still
expensive.
expensive.
And
And at
they-
least part-time gives you a break.
Yeah.
And often you learn tips, if you have a caregiver in the home, you learn tips and things that they know that have worked with other people. I mean, you're lucky.
One of the nice options that we do have here on Kauai are the adult foster homes. And those were not a concept that was foreign to me before I lived in Hawaii, but it's a very legitimate placement option here on Kauai. I think we have 26
You need to get on
here
the
on
list.
the island.
There's a
You have to
waiting
get on the
list.
list. Occasionally, if you, basically the Agency on Elderly Care has the list of all the home care homes. And occasionally you'll call and they'll say, we have a bed. Some of them do private pay, some of them do Medicaid beds. A lot of them have a combination of both. But that's very frequently what does happen if people don't have the finances, then you find yourself in that position where you're spending down so that your loved one can get Medicaid, so that they can have coverage for care. And that's a horrible thing to, have to spend down your nest egg to be able to basically make yourself destitute, or make your loved one destitute so that they can get care. But that is the way that a lot of people end up having to do it here in our country.
It's almost 15,000, 16,000 a month
At
for
Burnham.
long-term care. And who had, you couldn't work a third job and maintain that,
Yeah.
I think the other thing was that you had mentioned long-term care. My mom had long-term care, but fortunately she got the assisted living rider on her policy because she doesn't need long-term care yet. And she has to pay almost as much for assisted living, so we're so thankful she got to do that.
Yeah.
So it's 15,000 a month
Garden
at the
Island.
Regency?
No, Garden Island long-term care.
Oh,
Regency's,
yeah.
One cares a little less.
Wow.
Regency's a little bit less,
Yeah,
yeah.
but
It's
you
still
pay for
very
all the
expensive.
a la cartes with that, and it adds up really quickly.
Wow.
And that's one thing that you run into frequently with assisted living is they do these a la carte kind of services. And so they give you a
that
price,
seems so
but
reasonable,
then
though.
you need to pay for them if the person needs reminders to come down and have dinner. So having someone swing by while they're taking your or hey, we use help with the bath once a week. So.
Yeah.
You got the rider then? Yeah?
She got the assist, she added onto her policy. But if she had only long-term care,
Yeah.
they wouldn't have covered it
Yeah.
because poor care is not long-term care.
So that's your long-term care insurance, is that right?
Yeah.
Yeah, assisted living, you have to pay extra, but if she didn't have that, she wouldn't qualify as poor care.
Yeah, and if you're healthy and,
Not thinking about it.
now's the time to get it.
Yeah.
I'm kind of curious, sitting here and I'm not personally engaged with the issue now, but it's daunting.
Mm.
I mean,
It is
for a
daunting.
person who's just beginning to think about it, it's like, where do you begin to create a roadmap for you here on Kauai with realistic assessment as to what the special resources are
Yeah,
out there, like what's a waiting, who has a waiting list, which you're gonna get right in, who do you connect to, what's the pipelines, what are the different places you for endpoint planning? How do you prepare when you're 40 and 50 years old financially? I mean,
right.
it's too late, it's almost like it's too late.
No, I
You're
know.
here now, it's really
There
great.
is
And 90% of 40-years do not want to have this
Exactly. I mean,
conversation,
how
so
do
they're
we-
not going to.
Yeah, I'm seeing
That's why I
many-
say don't have a big
everybody here is
conversation,
well off.
have little
They-
conversations, have lots of little conversations,
But
But does AEA have that kind of information?
Yes, they have several of those kind of things. We have a lot of that information too. But it's a really hard
it's
thing
almost
to try
fighting
and
two
navigate.
battles.
Well, I think the first thing is, get your advanced healthcare directives.
Yes.
That's the first thing to do. The next thing to do is realize that nobody knows how your life's. Nobody knows if you're gonna get
Hit by a bus
by a
or
bus.
Yeah. Yeah.
Nobody knows what's ahead for any of us. We all may live to be 100. We all, you know.
That's
may
why it's
get less-
insurance, huh?
Right. But for me, what I thought about was, yeah, do I want to pay for this insurance every month you know, that I may never need?
Yeah.
And then I thought, do I want my kids to have to come up with this money every month if I'm in a care home or if I need a caregiver? Do I want not being able to afford it be the limiting factor that decides whether or not they hire someone to take care of me when they should be hiring someone to take care of me? And for me, the answer was no. I don't want finances to be the limiting factor for them. So for me, I said yes. I'm getting long-term care insurance. You know, I'm not here to tell you what you have to
So
get
how
it.
long ago, I mean, when did you, I mean, how many years, or I'm not gonna ask the age, at what period of time did you decide, okay, I'm gonna get, because I heard mine's very expensive. In your,
In my late
So-
50s, yeah.
One thing you want to think about is if your kids are working probably on the mainland, maybe in Honolulu. My company had insurance that my parents-in-law bought that they were, parents and parents-in-law were allowed to buy because of where I worked 35 years ago. But it was a very good deal for my parents-in-law. And my father had it because he had it from his work. But it was a very good
yeah, they
deal.
offer that, yeah, from employment.
Yeah.
But then
Because
this gentleman's situation, it's like you're wondering, should you get long-term care insurance now, at this point?
It's less expensive the younger you get.
Yeah. But
less
also,
But you're paying for it longer.
from my experience, because it's
Insurance, you actually.
a blended risk pool, it was less expensive for everybody.
Oh,
And the company paid for it for me at the time. And my parents-in-law kept paying it even after I changed jobs.
Oh, yeah.
So it was,
That's good.
you might have that possibility. I doubt on Kauai that any company does that. But maybe Oahu, maybe, certainly on the mainland some do.
Robin, my mom paid for 30 years.
She paid for 30
She
years
invested
before
almost
she...
100,000, but it's
But you
still
know-
gonna be less than what she has to pay.
Yeah,
And like, I'm so thankful she got it because
yeah.
Yeah.
Yeah,
she'd have to either mortgage her house or,
Right.
you know, to pay.
I know people whose option has been either, you know, if I'm going to put them in care, I have to mortgage my house.
Yeah.
And, you know, nobody wants to do that. So,
Yeah, but it's a real factor, you know, for a lot of families here. And so, you know, that's where we really push getting your team, you know, if
Getting
them not leaving this house, if they are going to age in place and die in this house, we need to build up your team
yes.
so that you have people that are gonna come in and help you and relieve you, so that you can come out to something like this, or you can go and do your 30 minutes of respite, whatever that is, going and taking a walk on the beach, or going and sitting in your room with the door closed and reading a book, or, you know, whatever that is.
That's my respite, my relaxation is, and I didn't discover until after my parents died, which is, but that's okay, now I know what it is. It felt so decadent for me to do it that I would never do it. But if I go in my room and read for a couple hours, you know, not the journals that, you know, that I have to, but like a mystery or a, you know, that to me is, I feel so good afterwards. Or if I sit and I knit without talking to anybody, just sit and knit for a couple hours,
Kind of meditate.
it is meditative for me to knit. But I doubt that anybody in the room has those sort of things. But those are unique to me because everyone has something unique to them. For my daughter, it's baking, which is great for all of us.
Yeah,
Everybody has something.
Except for that suggestion not to eat sweets.
She was very offended about the caffeine.
She likes
it was sweet. It was, I thought you were saying it was about your dad. I liked it.
Well,
I was thinking that you were a soda drinker.
That's
You
fine.
know, you can have.
I'm intrigued.
Excuse me. I was wondering, you know, it's, I think my situation is kind of different, you know, but I'm sure everybody started somewhere with this kind of a journey. It's like, Zoe, you know, but anyway, I'm starting to question myself. Like, what is happening? What's happening? You know, in our household, we're friends. Friends for a long time, going on 27 years, just friends. And
So
I'm
are
not
you
sure.
saying you're questioning what's happening with them, or
Wait,
your own sanity,
the
or-
starting, like, that's why I'm here, you know, but this is good to know, but I guess I'm gonna have to start somewhere at the beginning, like,
No, it's good you're here.
yeah, but it's good to, you know, get as much information as I can, because I'm not quite sure what I'm dealing with when, especially the other person thinks
There's
nothing is
wrong. Yeah.
wrong. I mean, it's like,
Yeah.
and it's too much of you know, I feel like I went through the stages of grief, you know, and I got to the point of acceptance, but
Yeah.
now I gotta start self-caring.
Yeah.
And you know, everything. So tomorrow I'm gonna start the Qigong class over at
Yay.
KCC.
That's perfect.
Yeah, I signed up today
Okay.
for that, you know,
Yeah.
and because it's, wow,
It's
it's just me and him and the dog.
Oh, he can.
And the dog is something else, look.
Oh,
Oh, dear.
He's like you know, this like wild dog. And then it comes from the training, and there's only 2 of us. And you know, he's very isolated, yeah, he doesn't have many, you know, like social things.
I worry the most about people that are caregiving for someone, they're the primary caregiver, and they're doing this completely by themselves, because for a couple of reasons. We had one caregiver that, I heard this story when I first started working with the association, and it just kind of shocked me, but then the more I thought about it, I was like, I see how that can happen. You know, frequently when we deal with dementia, people are living in a different decade, or, you know, they kind of revert to maybe their childhood days, or maybe when they were, you know, an important time in their life, maybe when they were working. And this gentleman was in the 70s. He was stuck in 1970 something. And the wife was the only caregiver, and they didn't really leave the house. She was doing 24-hour care. And she basically got to the point where she would get into bed at night and lay there after he'd go to sleep, and she'd be like, is it 19, what year is it? Because she spent that whole day in his reality, because that was the easiest way to meet and deal with him. But then at the end of each day, she was questioning her own sanity, you know, because she had immersed herself so much in his situation. And I think that that's so easy to do, you know, if you're the primary caregiver and you don't have other people coming in, and you don't have family helping, or neighbors stopping by, or coworkers, you know, you need to have other people that are coming in that I hate to say it, but like in the sitcom, they provide the comedic relief, you know, somebody that just comes in and
reality.
takes you away from your really, you know, sometimes tough reality for a few minutes is really important.
Yeah,
If
that is so true.
If
That
that's
is
where
so
you're
true.
at, if you are that one and only caregiver, you need to find a few people in your life that
I don't think we're even
for
close to that yet.
Yeah.
It's just, you know, right at the beginning.
But now's the time you need to be talking about what you each want. What, you know, what is important to you? What would you, you know, if I got dementia and I couldn't talk, I don't know if I, you know, do I want to be alive?
Well, I agree, the conversation should be held sooner rather than later.
Right, and you need things written down, particularly,
I'm starting to document things,
but you need,
you know, because this other person is just like, no, I didn't say that, I didn't do that, you know, and it's like, You know, so I have a folder now that I've started, but the point is, 27 years, friends, we're both single, and I'm at the point where I'm taking care of myself, the self-care thing, right at the beginning, and because I fractured my back like 7 times in the last 3 years, and I just started walking again, you know,
He was
a couple of years ago. Yeah, you know, with the walking sticks and everything. So now it's like, okay, now we're dealing with something else. It's not the physical, because physically he's fine, he's strong, and yet it's the mental.
That's
You know, and then not even
And
wanting to go
it's
to a
important.
doctor.
It's very important for you to make sure you have directives in place saying who you want to speak for you, because.
Oh, we have all that. Yes,
Right,
we
because
have all
it's gonna
that.
be-
We have
is it
everything said, but it's just trying to communicate with the person. Do I just keep, you know, documenting? Because he refuses to go to the doctor.
If he has dementia,
No, but how do you know?
but is that what you are concerned about, that he has dementia?
Well, something's going on mentally, you know, I know,
So
because
you and I can talk about
I'm
this a little bit more,
documenting.
but what I was gonna just say is if dementia is present, dementia is not normal aging, dementia is a disease.
right,
And with that disease, nerve cells in the
Right.
brain are dying.
right.
So you writing things down isn't gonna make the situation better. It's probably gonna drive you a little wonky and crazy,
That's
because.
Well, I need
And
to
it's
be,
gonna
well,
make him
that's my
angry.
way of, you know, proving something.
But you're not
Proving
gonna
to
be able
him,
to-
because I'm gonna show him, hey, look, on
But
this
the problem
day.
is-
Other than that, I don't know. I don't know
But the
really what
problem
to
is,
do.
he doesn't remember what he said, and you're writing it down.
Well,
If you're
he's at the
writing-
point
stop.
where he's halfway.
You need to listen to me now. If you write it down, he's going to not remember that he did that, and he's going to think you're.
Eventually, right? He won't
He's going
remember
to think you're
eventually.
making things up about him. And you will become the bad guy.
I'm already the bad person.
Well, it's because you're writing things down.
Yeah, so I think maybe I'm at the wrong, I mean, you know, the information was great, but I'm wondering if there's something that'll get you right at the beginning, because this is, like, I'm walking a line right now, because we're friends. I'm at the point where, how much am I gonna put up with after 27 years? I
Right.
cannot just like leave them, you know, I need to take care of myself, I need to get all the finances, everything in order for this person,
Do
We can
you?
talk.
whoever he's becoming,
You need to
you know,
tell us.
and so it's scary. Like
need
I
to
said,
tell-
I went through the 4
Yeah.
stages of grief. I lost my son, and my daughter, I have 3 children. My son died in 2004 at age 23. My daughter died last week Wednesday, age 55, you know, cancer. And then I'm dealing with, you know, kind of like with this, my partner of 27 years, you know, the person I've been under the same roof with, it's like becoming a different person. So I'm right at that,
You need to talk one-on-one.
Oh,
Yeah,
yeah,
we will
right
talk
at
Then
that,
you need to talk to a
Please.
lawyer too.
already done.
Okay.
Yeah,
you-
all of
you
that
and
is
I- you
already
and I can
taken
connect.
care of.
We can
Yeah,
connect later,
you and
okay?
Cindy need to.
For sure.
Yeah, it's just that there's this trust, you know, I mean,
Sure.
the trust, not the,
Yeah, we can,
yeah.
we can talk.
Yeah.
Does anybody have any additional questions? If not, we can wrap things up. And Robin, I can get people in touch with Robin if they, you know, have anything further that they want to ask about. And you guys can always reach out to me. My card is over there. I work full-time for the association, so, you know, this is my job. Let me help however I can. And then, yeah, the taking care of yourself one is right over there. Feel free to grab that one. Also, really quick, this may actually be helpful. They're just in the early stages of doing this, but this is the Hawaii Dementia Initiative. They basically put this together for Oahu, but then they reached out to me and asked me if I could give some local resources. But this is a really great little book. It just got published this last month. but it's got all kinds of information about it, about dementia and some resources, and just lots of really good information. So I would encourage you to grab one of these as well before you leave. I think it's just a really handy resource for local stuff and just general information. So thank you very much, Ms. Robin, for coming.
Yes, thank you.
I want to do it just to keep you warm.